What made me believe in Serenity was that they were actually treating the root cause of my problem and not just the symptoms. My GI doctor was really a symptomatic treatment, which I knew was not the right way to go. And in addition to that, I needed a home test kit to confirm the presence of the SIBO condition. My GI doctor had trouble getting this test kit. It took over a month to get. Serenity got it for me in 5 days. Hi, my name is Greg Bolin.
And I'm Cathy Bolin, his wife.
I live in Oconomowoc, Wisconsin. I'm 69 years old, and I am a retired civil and environmental engineer. I've been retired for about 3 years. What made me say yes to Serenity had to do with my experiences with my GI doctor. Most recently, back in late July, I had issues again with my GI tract, and I wanted to get in for an appointment with the GI doctor, and it turned out it was about a month wait. And for me, that was too long. At that point, my wife suggested, well, why don't we try Serenity and Dr. Muth because of her past experience and knowing her and trusting her. And I said, great, let's do that. We went in for standard testing, and Deb came up with a diagnosis of SIBO and also Lyme's disease. Subsequent to that diagnosis, I still had kept the appointment with my GI doctor. My GI doctor, when we met with her and the PA, they didn't even talk about Lyme's disease. They didn't even talk about SIBO. They wanted to put me on Miralax every day, probably for the rest of my life. What may have prevented me initially from going to Serenity is the cost. Almost everything is out of pocket, but I knew that going into it. And I said to myself, and I said to Cathy, what price do you put on your health? So I'm very happy with Serenity, and I don't mind paying the out-of-pocket costs. The things that I tried in the past that did not work for me were the things that were recommended and promoted by my standard GI doctor. I had several belly x-rays. I had cleanouts using Miralax. Some diet changes I tried. None of that, although maybe a temporary relief, was not a permanent solution. I feel right now that I'm on track with a permanent solution with Serenity. What surprised me the most about Serenity was their availability and also the communications using the portal. I've used that several times to ask questions, and I get a response usually long before the 48 hours. So I like that as well. My life right now, I feel like I'm on the mend. I'm on the mend. Seeing her back in July, I feel better. I know I'm not out of the woods yet. I am on protocols for prescription medications and other things according to directions of Serenity. And I know that this is going to be a permanent solution. I've certainly gotten a lot more out of Serenity than I did out of my GI doctor.
I have recommended Serenity to a couple of my friends, and our daughter and grandson goes there as well.
Well, I would encourage people to certainly think about, using Serenity, particularly for people who have had chronic conditions and feel like they aren't getting any better. This is a whole different approach, is that we all know that it gets to the root of the problem. I feel a whole bunch better using Serenity and their recommendations than I ever would using a GI doctor, because I know the GI doctor, it's just symptomatic treatment. It doesn't get to the root cause of the problem.
We have a trust level with Serenity that we do not have with the regular doctors, only for the fact Dr. Muth is looking at your entire condition and your symptoms and coming up with a solution. And again, it's a large trust factor.